Hello, my name is Leigh Ann McGlynn with McGlynn Institute Neonatal. Welcome to another edition of our procedural skills series entitled Venous Pool Technique of Blood Sampling in Neonates. This was made through the help of our content expert, Janine Brown. Blood sampling in the neonatal population has its difficulties, including but not limited to tiny vessels, the need for frequent blood draws, limited vessel availability, and skill deterioration within the NICU. In the neonatal population, blood can be sampled by capillary, venous, arterial sampling, or umbilical line samples. But what I'm showing you today is a new type called the venous pool technique. The venous pool technique takes advantage of the capillary beds found in the upper extremities. This method was studied by Hattler and colleagues in 2013, and it found that this method for laboratory draws could be beneficial to decrease neonates' exposures to repeated painful laboratory draw attempts, as well as reducing potential for development of heel nodules. It was easy to teach and learn by nurses, and with the exception of a platelet count, the results are very similar between samples using the VPT method and standard methods. Site complications were comparable between samples, and nurses working with neonates should consider the VPT method as a way to quickly and easily obtain specimens for testing. In fact, Hattler and colleagues found that the VPT process was not only easily learned, but it may provide advantages over standard blood sampling methods, especially regarding hematoma development. The landmarks for using the VPT method are in the capillary beds that can be felt by starting at the antecubital fossa and palpating down the arm until a V is felt. Between that V is where those special capillaries lie. As with any blood sampling technique, you'll need to gather your equipment and supplies. For the VPT technique, you'll need a 23 or 25 gauge butterfly, a 3 to 5 ml syringe, 2x2 gauze, and skin cleanser such as alcohol, betadine, ChloraPrep, as well as a saline wipe. This all depends on your unit policy and the purpose of the sample. You may also need sterile gloves if drawing a blood culture, and it's a good idea to have the containers ready as well as the total amount required calculated. It's also a good idea to have your patient well wrapped with the arm that you will sample from out and in a downward position. In other words, position the patient so that the distal portion of the arm is downstream and, if possible, below the heart. This can be easily done with blankets or towels. The next step is to apply your tourniquet securely on the arm well above the site. Once the tourniquet is applied, rotate the arm with the thumb facing upward. At this point, it's time to locate your landmarks again. You locate the capillary beds in the arm by starting at the antecubital fossa and palpating down the arm until the V is felt. Between that V is where the capillary beds lie. Once you've found this site, then cleanse your site as you would per unit protocol. It is recommended now that you cleanse that site with a saline gauze as seen here. Once the site is cleansed, you can then dry the site using a sterile 2x2 and mark your spot again upon which you will make your puncture. At this point, you can prepare your butterfly by removing the end cap and making sure that the bevel is up. You'll then insert the needle, bevel up into the capillary bed, and look for blood return. You may need to adjust your needle angle from time to time. You can start with a 30-degree angle, and you may need to adjust in order to reach that capillary bed. Once blood return is seen, you will want to hold there and allow that blood to make its way up through the tubing to the end of the hub. Once the blood gets to the end of the hub, then gently apply negative pressure. Often a milking motion can be helpful. Once you've obtained your blood sample, cover with gauze, cover your sharp, undo your tourniquet, and your procedure is done. Now it's your turn to perform the venous pool technique. Let us know how this video helped you in your actual practice. Looking for amazing NRP, procedural skills courses, or simulation-based training? If so, give us a call here at McGlinnInstituteNeonatal. You can contact us by 704-728-4961 with call or text, or email Dr. McGlynn at drmcglynn@mcglinninstitute.com. We look forward to hearing from you soon.